I'm such a dummy. My husband is yelling from downstairs. You're muted. I wasn't muted. I just did not turn my mic on. That's how it goes. Anyway, I was just saying, well, I was asking y'all how you're doing. And I was just saying that I was a little bit sluggish because I had a bit of a heavy dinner. So I'm very ready for a nap, but there is no sleeping because we have the night shift today to save this patient. Also, I didn't have time to fix my webcam settings with my new light, so it's the old lights. This is what it is. Anyway, thanks for joining me. Today we are playing a board game for the first time. We are going to be playing Medical Mystery. This is going to be mirrored for y'all because my webcam's set to mirrored, but don't worry, once we start playing, you'll see everything perfectly. Medical Mysteries, New York Emergency. Drew says, I have a Nora on my lap. I can't type easily. That's fair. Maybe Nora can help. Maybe Nora has some really insightful... Nora's our cat. Has some really insightful ideas about how to save this man. So yeah, let me go over. So this game, this playthrough will have spoilers for the second patient of the game. I'm gonna do a quick explanation that's gonna be spoiler free, but once we start playing, obviously, there's gonna be some spoilers. So let's get to it. So Medical Mysteries New York ER is a co-op game. So you work together with your fellow players to solve a case. Think House MD, but hopefully with less assholes. It plays 1 to 4, but technically you could play it with infinite amount of players. But too many cooks in the kitchen, too many doctors in the room. I don't know. Anyway, the game comes with... Hi, Flying Pancake. It comes with a tutorial patient and 4 patients. The tutorial patient will teach you how the game plays, which is nice because it means you don't have to read an entire rule book to play. Hi, Frost Knight. How are y'all? And like I said, it comes with 4 patients. It has 1 easy, 2 medium difficulty, and 1 hard. I played the tutorial and the easy one myself, and today we're going to be helping the second patient, which is going to be of medium difficulty, so I'm very curious how that's going to go. Again, spoiler warning, because this is a game that you can't really replay unless you suddenly forget everything about it, including the results. But before we get into it, let me explain a little bit how it works. Which, by the way, again, the tutorial does a really great job of doing. So every case comes in a little envelope, and that will list what is inside. In this case, we will have a patient intake form. I'm going to show everything on screen later once we start playing. 1 patient electronic medical records, 34 story cards. Frost Knight says, I'm so bad with memory, I can play many times. That's how I feel, but I always tend to remember the annoying things that you want to forget. There is I saw that there's also a Miami one though, so there is already a next one. So, no need to replay. You can just give it to someone else. Because that's the fun part. The only thing, no, I'll finish my explanation first. Yeah, so the story cards, and you get a few status cards, and there will be 1 epilogue sheet in here. Do not look at the epilogue sheet because it will spoil the entire case. There's also going to be some scoring on there. Drew says, a lot of medical mysteries in Miami, I guess. Anywhere, right? And if House taught me anything, it's always lupus. Okay, so you basically, once you start playing, you start by reading the patient intake interview and the electronic medical records that I talked about. The interview will, at the end, instruct you to take story card 1, and also status card 1. So it comes with like the start and also a status, which will say in this case, which is not really a spoiler, confused and lethargic. And then it will list some stuff you can do. Actually, both of these, both the story and the status card, will give you some actions you can take, like asking additional questions to the patient, or do some exams, ask the opinion of experts, etc. I will put these on the screen once we're playing, so y'all can see what we're doing. However, you only have a limited amount of time. You get 3 actions per 2-hour window, which will be again. This will be mirrored for now. Which will be listed like this. And after these 3 actions, you will receive an update as the thing will remind you of. And this will depend on your current status card. So all of the actions that you take come with a little code like GAS, which you then look up in this neat little booklet that comes with the game, which will give you, it'll either give you it'll tell you to take a certain story card, or it'll just have a little text blurb about something. So, and then you will write all of that down on your little patient form. And I believe you have about 8 in-game hours to like correctly diagnose the patient and treat them. I've not gotten that far yet, though, so I'm not sure if you can keep playing after that or not. And also, like, these updates that you get could either, like, your patient could deteriorate. I haven't had a patient die in the tutorial or the first one, but I believe it is an option. People don't be coming to the ER for nothing, you know, usually. So if you've correctly diagnosed and helped stabilize your patient, you will be instructed that you can fill out the back of this, which is the final report, where you will list the cause, the treatment, and also your recommendations. And after that, it'll tell you to look at the epilogue sheet for the answers and some endgame scoring. I know that with my first patient, I got the result of like, oh, you stabilized her. Do you know what's going on? Yes or no. If you feel like you're done, you can go to the epilogue sheet, which is very dangerous because I was just like, oh, what am I missing? And spoiler, I was missing something. Personally, I don't really care about the scoring with this because it's just about filling the things in. But we're gamers, we gotta have our little scores. Oh yeah, and lastly, the game also comes with some neat little research sheets about like what different kinds of tests mean, about certain conditions, certain drugs, which can help you like try to decide what you're gonna do. That's basically an overview of the game. It'll make more sense once we're playing, but unless anyone has any questions, we'll get into it. Frostnite says, yeah, my memory will trigger stupid things, and games like these I'll always end up recalling. Yeah, exactly. I have the same thing. I'll forget the stupid, like the most important things, but then something like this. It's just, let me pull up chat so I can more easily respond. Have you not seen Scrubs or House? I've seen some episodes of Scrubs. I have seen House. Okay, let me see. All right, we're here. This is the first time that there's no music, because usually I have a video game playing. So my lovely, sweet husband took photos of all the cards and uploaded them in OBS for me. So I'm able to show you so we can work together. Let me see. So, like I said, we have our electronic medical record. Okay, it's going to be giant. Oh, I hope this works. Nope, that's the background I'm moving. Don't do that. Why is it moving? It's not doing what I want. Okay. Oh, this is gonna be so huge. I don't know if y'all can read this. But this is a little less interesting. This is the back, which we'll get into. And we've got the interview, which I will put up here at first. Can't read? Why can't you read? We'll start with the front. Full size is better. Yeah, I know, but I want more information on the screen. We'll see. We'll see how it works. So we've got... I've tried to practice his name, and it was not working. We've got Alex Alexopoulos, which I think is Greek. Actually, even the envelope, it says, your next patient is Adrian... Oh, I said Alex, but his name's Adrian. See, I'm a terrible doctor already. Or maybe a typical doctor. Your next patient is Adrian Alexopoulos. He is brought by his wife, Thea. Adrian is out of it and can't speak. Fortunately, she has a story to tell. So we've got Adrian. I'll refrain from saying his last name. He is 82 years old, male. Thea, a few years younger than her husband Adrian, meets you at the examination room door. She's crying and is distraught. Doctor, thank goodness you're here. My Adrian, I don't know what to do. He wouldn't get out of bed until afternoon today except to go to the bathroom. He's miserable, but he's a tough guy, so he won't show he's having a hard time. He keeps saying he's fine. But, sorry, I laughed at what Eric said. I know, I was like, that's such a, but, you know, we just played Dispatch, where his name was Robert Robertson, I think, so, you know. But he's a tough guy, so he won't show he's having a hard time. He keeps saying he's fine, but a wife knows these things. We do know these things. I've heard people say that if a wife brings in her husband, take it seriously. Thea talks quickly, and it's hard to follow her thick accent. Okay. Considering how upset she is, you realize that listening and letting her talk may help calm her down. Thea continues. Pinned. Sorry. Thea continues. He's been to the bathroom so many times today I've lost count. And tonight at dinner he didn't want to eat my lamb stafato. Sorry for butchering that, probably. I knew something was wrong. He loves my stafato. Who wouldn't like stafato? It's a slow-cooked stew, me, because I don't eat lamb, but it's a slow-cooked stew made with lamb shoulder and onions in a sauce spiced with cinnamon and cloves. I've been making it for almost 70 years, she says proudly. I even made Adrian's favorite. Oh boy. Sfakianopita. But with almonds, without almonds, because I don't like nuts. So you can imagine how concerned I was when he wouldn't eat any. He kept saying he was fine. He is so stubborn. He'd never admit he was sick. He wouldn't want me to think he's not strong. She wipes her eye. Stubborn old man. His mother warned me when I married him. My son is stubborn like a brick wall, she used to tell me. When he was a boy, he had his mother make his favorite snack after school every single day. A banana with a smear of peanut butter. Something to give him a little energy to keep up with his older brothers. Thea is quiet for a moment. Something you sense rarely happens. Wow, rude. Oh my gosh. Sorry, chat has been. Then she says, he's been sick like this before. It usually happens after he goes golfing. I think he's eating some junk at the club that doesn't agree with his stomach. But tonight, he's got me really worried. It's worse than... Oh, I'm not showing you all this, sorry. There we go. It's worse than it's ever been. He wouldn't even argue with me about calling the doctor. And then... Thea breaks down and is unable to speak for a moment. Thanks, Trees. I heard a crash and found Adrian lying on the bathroom floor. He was bleeding from his head. I couldn't get him to sit up. I called the ambulance immediately. Adrian didn't say a word the entire way to the hospital. She grips your arm. Please help my Adrian, or Alex, or whatever the hell his name is. The patient is confused and lethargic. He is unable to understand or answer your questions. His wife Thea is more than happy to tell you anything you want. So it says, take story card 1 and take status card 1, confused and lethargic. I will pull this up in a second, but let's first look at the medical files. So in the front, I'll make this bigger for now. Oh no, it's covering me. No. I'm more important. Okay. So we got his age, his height, and his weight. He's my height. That's funny. Occupation. He's a retired gardener. He's got some complaints. He had some bruising and a cut on his head. There's confusion and lethargy. And with his pelvis, he has diarrhea about 7 to 8 times per day. That's rough. There's no recent travel you can see, but there's no recent illness either. And he has some medication for his blood pressure, which is one we can look up in the little booklet. And he has some known allergies for penicillin, contrast dye, and bee sting. As for his vitals, they're all right. Hope he's drinking a lot of water. I know. I hope those fluids and electrolytes are getting refilled, because woof. His heart rate is a little higher, and also his lung capacity isn't the best. Past medical history, no recent antibiotic use. He's got hypertension, which is high blood pressure, and his appendix got removed when he was 50. Family history, he has 2 children. They're both healthy. No history of heart disease. He immigrated from Greece at age 23. And then his admittance exam. Nope, that's not the correct one. This is all on me. Teresa did a wonderful job labeling these. So, in general, patient appears confused and lethargic, doesn't speak or respond to questions, pulse is steady, no contact with sick, I thought stick individuals, I'm like, what? Sick individuals, wife has not had similar symptoms. He is cooperative, his respiratory is normal, there's no sons of bitches, there's no shortness of breath or cough, and the head, ears, eyes, nose, and throat. His eyes are sunken. There's no changes in vision or hearing. He's got a mucous membranes dry. Okay. No sore throat, neck stiffness, or tenderness. And so neurologically, he's lethargic and confused. Cardiovascular, vascular. Pulse is steady, heart rate increased, no palpitations or chest pain, no murmur, and capillary refill 2 to 4 seconds. I don't know what that means. I can look that up. Muscular, skeletal, normal muscle and joint pain. His abdomen is soft, non-tender, no palpable masses, so nothing they can feel. And his extremities, there's no edema, so no swelling, and are non-tender. His skin's elasticity, God, these words, is slow. Gastrointestinal, he has diarrhea, non-bloody, 7 to 8 times per day, 4 times 4 days, I'm sorry. He gets diarrhea every couple of weeks that typically lasts for 2 days. No vomiting, no fever. Appetite patterns, usually loves to eat, but not in the last few days. He's lost some weight. Possible ingestions, he and his wife ate out at a golf club last Saturday. They shared the steak. Then there's a word I cannot pronounce, but it has to do with the genitals and stuff. No itching, burning, or pain with urination. No hematuria, so no blood in the urine. Intake of fluids, always has his coffee. There's dark urine in small amounts. Total urine output unknown. And his last physical exam, he was 178 meters. I don't know how many inches those and feet those are. I think it's 5. It's how tall I am. So I think it's like 5'10", almost 5'11", something like that. Well, Eric, your total urine output is a lot. I can tell you that much. Frost Knight says, I blame the steak and lamb. Solved. He can go home. It's a steak and lamb. Weight, 84.4 kilos. Okay, so we already know that he has lost some weight because he weighs 77.1 kilos now, and in his last physical exam, it was 84.4. So that is a lot of weight loss. That's almost 7 kilos. I don't know how long ago this was, but... And the last time, vitals temperature, 36 degrees, which is fine. And his heart rate was 97, so that was a little lower than it is now. Right now it's 102. And blood pressure was 140 over 92, which is about what it is now, which is like, all right, which is good to all right. Okay, so that's the information we have. It also told us to pull status card 1. So I'll show you what it looks like. Let me close these for now. So this is what a status card looks like. It's the one that we have. So he is confused and lethargic. And it gives us a couple of options we can take. But again, we can't take all of them because there's just not enough time. And the back of the card basically looks like this, which will tell us that for certain tests that we might do, it'll give us a code depending on what time it is, what the results of these are. And just because they're listed doesn't mean that you should take them, by the way. This is just like, if you do this, there's going to be something. So these are some of the things that we can do. But then we also have the story card, which I will also pull up. Andre's photographed every 32 of them. All 32 of them. Okay, let me try to see how I can move this. I'll move this to the side. So that's his wife, that's Thea. And we can ask some questions if we want. So right now we're going to try to figure out what we want to do. And the game tells us that we can spend 1 action per 2 questions, which is nice. Let me take a sip of tea. Okay, so what do we know about him? We know that he is confused and lethargic. We can only ask her questions. It says, Thea takes your arm and moves you away from Adrian so as not to disturb him. Ma'am, you took him to the ER. We're not disturbing him. What happens when he goes golf? And obviously not every question is going to be as fruitful. So what happens when he goes golfing? We can ask, who has he been in contact with since he had symptoms? What has he eaten in the past week? Has he been sick like this before? Which does sound like a good question to ask. But then we can also, as the status card says, so we can interview her. Tree says, Theopoulos. All right, stop bullying me. Did I say that, by the way? Or, so we can do some blood tests. We can do a stool culture, a urinalysis, CT scan of the brain or the abdomen. There's some treatments we can give him, which I don't think we should start on right now. And then there are 2 experts that we can call in. We can call in a gastroenterologist, which is an expert of your like gastrointestinal situation, or a neurologist for his brain functions. And again, like, you don't have to know all of this. Like, the game comes with these booklets that will explain what all of this is. which is very nice. And apparently this is very accurate. I saw a review of someone who said that this game was not fun to play with doctors because they were just like, bam, 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 this is it. I think we should... I'm leaning towards starting with asking some questions. What do you think? Eric says, I feel like he needs a brain scan. Drew says, I hate doctors. Yeah, well, sometimes we need to go to a doctor. Sometimes we need to go to the ER because we have fallen and hit our heads. A brain scan. Yeah. There has to be a reason why he's... I am going to start with asking questions. I'm going to ask question number 4. So I'm going to write down on my little form. So I was going to say this during my explanation. The game only comes with one of these for each patient. And I wish it just gave you like a couple, because if I want to either sell this game or give it to someone else, I'm going to have to try to find a way to get more of these, because that's like the only thing that you're actually like using. And this can't be that expensive to print for them, I feel. But yeah. So yeah, I'm going to ask questions. I'm going to ask question number 4. So has he been sick like this before? And what else should we ask her? Because we can ask her 2 things. Eric says, he hit his head hard right before getting here. I don't know if they can just die, but head injury is bad. Yes, they can in fact die. Tree says, ask question number 2. My mom says question number 1. And Frostnight says, it's one of the reasons why I don't do exit game. They play once, but you destroy the game aspect. Yeah, I can see that. With those kind of games, though, I kind of justify it to myself. Like, if we're all gonna go see a movie, we're also gonna be spending a lot of money for a one-time event. So that's how I try to approach those exit type games. I don't play them because I think that I have trouble with them, and the hints are so stupid that I crumble them up and throw them across the room. I think I even ripped one in half with my teeth. I might have like I might have eaten one of them. Anyway, I got mad playing that. Eric says, I feel like asking what he ate will just get the same response in Thea's intro thingy. Maybe. Eric says she did do all the things. I did. Got those hints. So silly. Anyway. Alright, so Dree said number 2. Okay, so we're going to ask her question number 2 and question number 4. So let's start with 2, since that's the first. So it tells us that for question number 2, we look up the code BWV. Flag Maggie says, just ask yourself, what would Dr. House do? He would make some sort of sexist remark and then be right in the end. Not about sexism. BWV says, take story card number 4. So we are taking story card number 4. They look like this, by the way, but not mirrored. All right. Oh, wait, I can show you all this. Thea says, we live alone. Sometimes... Who has he been? Oh yeah, so we're asking who has he been in contact with since he first had symptoms. We live alone. Sometimes our children visit, but Sophia and Andrew live far away. Adrian goes golfing every first Sunday of the month with Bill, Dimitri, and Harry. None of them are sick. We've been in our brownstone for 37 years. So much has changed. We used to know everybody. Now they're all... What do they call them? Hipsters. Young kids with too much money. Adrian says... that sounds like a lie. Adrian says they don't know a thing about saving for the future. Like spending $3,000 on a bicycle. Can you believe it? That's more than my wedding ring costs. Right, Adrian? Thea turns toward Adrian in bed, then suddenly breaks into tears again. Oh no. We made her cry. Alright, so she's like, damn those kids and their money and their $3,000 bikes. Eric says, I blame the children. Yeah, they did it. They made him sick. Oh, the result code was BWV, I have to write it down. And then the other question that you can't see right now, and now you can, was, has he been sick like this before? USW. Drew says that's crazy money for a bike. My bike came close to that number, Dries. Eric says, y'all got married in 1845. I hope your wedding ring was less than 3K. I know, right? Alphabet is hard. So, write it down. USW. And that says, take story card number 3. So we've got number 3. Thea says, it's been happening for about 6 months. He's his usual quiet self. Then he goes golfing, and 2 days later he gets a fever and stays in bed for 2 days. At first, I thought he was pretending to be sick to get me to take care of him, but he won't even go up to our rooftop garden, and trust me, it takes something serious for my Adrian not to check on his azaleas several times a day. I don't understand. He's been on a diet. He's supposed to get better, not worse. Okay, so she's noticing a pattern, right? He goes golfing and then he stays in bed. So 6 months has this been happening? There's not enough space to take notes. Eric says, rooftop garden? I know, I had the same internal. I'm like, you're what? These fucking people. But no, 3,000 for a bike is insane. Andrew says, I should also pretend to be sick sometimes. Seems legit. Yeah, well, 6 months. Has it been going on? It might actually be tied to golfing, so we might want to ask questions anyway, but and he's been on a diet, which is also interesting to note. Been on diet. All right. And Eric said we should do a head scan, which I tend to agree with. I think, or do we want to do a head scan or do we want to ask a neurologist what they think? I mean, we're just a ER doctor. Well, they're still doctors, but we're not experts. Eric says, I feel like the gastro expert might be more needed. Yeah, I think we should, with what they're saying, I think that is a good one to call in. I'm worried about his head. But sure, let's ask the gastroenterologist. Andrew says, remember, he has diarrhea. He does. So we're gonna ask call in the expert. That's an entire action. Gastro. And the result code will be RSZ. Z. The gastroenterologist says, I can't tell you much without more data. Either take an abdominal CT scan or try a stool culture. Eric says, interesting that you have to make giving an IV a thing when I'm pretty sure they just stick you with that right away. Do they? I haven't gotten one of those unless I was actually admitted. In fact, I want so my gallbladder got taken out when I was 19 or something. And after the surgery, I got an infection in my stomach, which meant I had to go to the ER because I was in so much pain and I was almost fainting and stuff. And they didn't hit me with an IV when I went there, but not America. Okay, so he says basically do a stool culture test or do a CT. We have one more action until we get an update on our patient. There was no blood. So maybe we should try a CT first. So, actually I can say what the booklet says. So, about tests. It won't open. Okay. A stool culture bowel movement test to detect bacteria that cause infection of the lower digestive tract. That's what a stool culture does. And a CT. Yeah, so about CT scans, I say a series of X-ray pictures providing more detail than a conventional X-ray. Usually the first choice for imaging to identify disease or injury, particularly complex bone fractures and severely eroded joints. A CT scan can detect tumors or lesions within the abdomen, various types of heart disease, and head trauma, injuries, tumors, blood clots. However, some soft tissue conditions, such as ulcers, may not always be apparent. Contrast dye is used for most abdominal and pelvic CT scans. Oh, that means that we should not do that because he is allergic to contrast dye. So we actually should try to avoid giving him a CT scan. For at least not for the abdomen. So see, that's why it's good to read these. So let's do the stool culture. Let's see what that says. I am worried about cancer. He's old, and with his diarrhea and stuff. Stool culture. Eric says, I think stool culture and brain scan. Yeah. Well, I have to pick one first, and then we're going to get an update. So we'll do a stool culture, and we're going to do JUH. Why does it only get bad after golfing, though? I know. That's a good question. I wonder if golfing means he drinks a lot of alcohol and, Okay, so JUH. Take story card 28. So I'm going to pull up 28. I'm also going to grab it myself. Oh. There's something there. All right. The gastroenterologist shows you the stool culture results. Well, this explains a lot. Your patient has salmonella. Okay. So, we know he has salmonella. Salmonella. I'm gonna look that up for y'all. So the booklet says salmonella, bacteria that can cause inflammation in the small intestine and colon. Incubation period is 6 to 72 hours. Stools are loose and bloodless. Diarrhea typically resolves within 3 to 7 days. Fever, abdominal cramping, chills, headache, and myalgia, which is muscle aches, are common. The most common sources of salmonella include beef, poultry, and eggs, although almost any type of food can serve as a source for infection, including improperly prepared fruits, vegetables, dairy products, and shellfish. Stool culture will confirm presence of the bacteria. Imaging is not usually done. If the symptoms are severe, consider antibiotics, then identify the source. Eric's saying, oh, he's eating the raw meat at the golf club. Maybe, or like, again, eggs. People don't notice, but actually salmonella is on the outside of the egg. Although maybe in America it's different, because I think y'all wash the egg, but I'm not sure. Oh, that's getting cold. Okay, so we figured out he has salmonella, but we're gonna get an update because it is now 2 a.m. and it says read the update from the current status card. So again, status card 1 back. Nope. The front. Oh wait, yeah. So on the bottom you see updates for 2 a.m. is SDD. Take story cards 9 and 10. Uh-oh, we're gonna get 2. 9 and 10. Let me pull those up for y'all. Okay, there's gonna be 2. Let's start with 9. So 9 says, when you check on Adrian, Thea pulls you aside nervously. All these tests? How much are they gonna cost? Not that we wouldn't do them, but, you know, Adrian usually takes care of things like this. You assure Thea that Adrian's tests are covered. She breathes in relief. You know this is an American game win. Thea says, I work hard to take good care of Adrian. I feed him well and save what I can by shopping the specials at Bargain Food for less. It takes extra time to shop the specials, but I have plenty of that at my age. A few months ago, they had canned chicken Adrian likes to have on a salad and fancy peanut butter for just $2 a jar. Can you believe it? I get all sorts of bargains. Honey, ham, canned tomatoes, even sardines. Last week they had salmon freshly caught, not farm raised, and eggs. They always have a great deal on eggs. He's eating much healthier, so I don't understand what's happening. All right, she's getting some bargain food that might be contaminated, although, yeah, Eric says, uh-oh. Poor Thea, she tries. This is going to be a story about food safety. She says, steak tartare? Maybe. Okay, so so that was the first 3 done. It is now 2 a.m. What do we do? Eric says, I got him everything that can cause his specific issue. I know. Okay, so we can give him antibiotics, which is what the booklet said we could do. He didn't have a listed allergy for that. Oh wait, so let me look up his, actually, because he has some drugs that he takes for his blood. He says sleep. No. Listen, he is taking lisinopril, used to treat hypertension. Side effects include low blood pressure, dizziness, and headache. Okay, I don't quite know. And if I look up antibiotics, it says drugs to fight bacterial infections, typically taken over a series of days. Some common antibiotics include amoxicillin, ceftriaxone, this is fake, ciprofloxacin. You know what? There's a few of these. I'm not gonna name all of them. But there's a few. Okay. Eric says 2 of those are on the list to pick. Oh, we can choose? Oh, we can. Oh gosh. Oh, you're right. Oh, let me show you what the drugs are. So we've got, well, I think an diarrheal is pretty self-explanatory. It's a drug that used to slow or stop down diarrhea. Caution should be used if the diarrhea is caused by an infection, as it could worsen the infection. Show me the drugs. All right, so we shouldn't do that because it is, in fact, an infection. Again, used to treat many kinds of bacterial infections. Avoid use if the patient has a penicillin allergy, as there is a chance of a potentially severe anaphylactic reaction. My mom's laughing at me in chat. All right, and he is allergic to penicillin, so we should not be giving him the ceftriaxone. Then we've got the ciprofloxacin. Exactly, Eric, he does have the allergy. Can cause adverse side effects, including diarrhea, vomiting, and nausea. So the other one is preferred, if appropriate. Avoid use if patient has ever had seizures, epilepsy, cerebral why did I do this to myself? Arteriosclerosis, which is a narrowing of blood vessels in or near the brain that can lead to a stroke or mini-stroke. Stroke, changed brain structure, or kidney disease. My mom. Oh, you were laughing because of Eric. Show me the drugs now. Exactly. As far as I can tell, I just lost my page. Seizure, epilepsy. I don't think he's had any of these. Eric said he definitely needs a brain scan. Yeah. It's interesting, though, because it does say that Thea does not have the same symptoms that he does, right? And while that doesn't necessarily mean anything, because just because one person got salmonella doesn't mean everyone got it. Her immune system could be better. But I don't think it is because what she is buying. I think it happens at the golf club. Okay, so that was a lot of information. And I agree, let's do the CT scan of the brain. And there you see the symbol of flipping the card. And I won't flip it again, but it basically says... Oh, fine, I'll flip it again. Status card 1, back. It'll show you the CT scan brain, and then we are between 2 and 4 a.m., so that's the second column. So we need DTC, brain scan. So let me look that up. DTC. Take story card 14. All right. Story card 14. Let me find out for y'all. Neat. 14. All right, that's being blocked. 1 second. Here we go. The neurologist says, compared to scans from when he was 42 years old, all right, so that's like 40 years ago, it is clear that this patient has brain atrophy. Brain atrophy is likely due to normal aging, possibly some dehydration. However, he does not appear to be at risk for stroke or brain injury. All right, so we ruled out, probably we should be giving him the ciprofloxacin. Yeah, I mean, show me an 80-plus-year-old person without a little bit of brain atrophy, right? I'm just writing down, brain atrophy seems normal. No stroke. Eric says, is it only one treatment or more? It can be more. My last patient, I had to give more. This seems a little too easy, so I feel like there's more going on, but you know what? I say let's start him on ciprofloxacin. He might diarrhea and vomit again. Eric, you and your IV fluids. Let me look that up. So we were looking at this, and then I just completely stopped doing that. So the epinephrine, drug used to treat life-threatening allergic reactions caused by insect bites or stings, foods, medication, latex, and other causes. Works by relaxing the muscle in the airways and tightening the blood vessels. I was thinking that maybe he got like a bee sting, but I feel like a bee sting wouldn't cause this since he's allergic. Eric says he's dehydrated. You're right. He is dehydrated. Whatever, just drink some water. IV fluids. Specially formulated liquids that are injected into a vein to prevent or treat dehydration, sepsis, and acute kidney injury. They are used in people of all ages and have a low risk of complications. He gets one bee sting every time he golfs, Eric says. Yeah, exactly. All those damn bees. Oh, this is a lot of talking. Okay. I'm gonna... should I do IV fluids first? I don't think it matters. Alright, I'm gonna star him on Ceproflex CPF. The antibiotic seems to be helping. Adrian looks vastly improved. Now you can address his other symptoms. Take status card 3. Improved, but still confused. Always confused. Status card 3. I will pull that up on the screen in a second. And when you get a new status card, you replace it. You replace the old one. So old one is gone. He is now status card 3 front. Nope. Why would I? I'm trying to move this. Come on. Okay. Improved but still confused. We do have... Was that a different... Oh, that's funny. It's now a different code for the IV fluids. Eric says, oh, that's how the ologists will learn more. I get it now. Yeah, exactly. That's how you're going to get different results and also different updates. But I agree. Let's give him some IV fluids for now. Because he is dehydrated. And that is going to be WDN. WDN, take story card 31. That's the last one. Okay. Oh, it's not the last one. Uh-oh. Dries, we're missing some. I've only got 32 loaded in OBS. We're missing 2. Well, if I have to pull one of those, we'll see. Alright, the IV fluids help Adrian recover from his dehydration. Almost immediately, Adrian becomes more alert and less confused. His cheeks are flush, and you hear him laugh at something Thea says. He's now even able to respond to your questions. Thea's openly crying, going back and forth between thanking you and asking Adrian how he is doing. Take story card 30. Well, I don't know, Dries. I only see 32 here, and there's 34 in total. Alright, so he is happy. And we are taking story card 30. Woohoo! Status, alert and improved. Adrian's cheeks are red, and he is laughing with Thea. You have dealt with his symptoms, and he is out of danger. Congratulations! Adrian has survived the night. As you leave Adrian's room, the hospital director pulls you aside. Good job with the old man, she says. However, it's important you find the source of his illness. Depending on how he contracted it, this could impact a lot of people. Thanks, Frost Knight. So take status card for alert and improved. Well, he wasn't confused for long. Status card 4. Move that to the side. And take story card number 2. Now we can interview him. Adrian is no longer confused and is able to answer your questions. It's challenging. Oh, I moved the background. No, I didn't. Okay, weird. Sorry, okay. It's challenging because his wife keeps interrupting. You get a nurse to distract Thea by having her pick a drink for Adrian, so you have time to ask him one question. So you get 1 action per question. How do you think you got sick? And tell me what happens when you golf. I want to ask both because I am curious, but I think we should ask number 2, right? Since it seems to happen. GOF, Eric says. Oh shit, sorry. Before we do this, actually, we did 3 things. So we're getting another update, which will happen on this story card. Look at these updates. Since that we got this right before for the end. So Z. Thea is sitting next to Adrian, who is sitting up in bed. Am I ready to go home yet? He asked cheerfully. That was his voice, this old man. Okay, so he's like, can we go? But the answer is no. You cannot, because we need to figure out. So we're going to ask question number 2, which is GOF, and we are looking up GOF. Take story card 33, then take story card 34. So those are the ones that I don't have, I don't think. Let me see in my folder. Maybe I just forgot to upload them. Where did we put these? I don't remember. I don't know where these photos are, unfortunately. Oh, here. Oh, they are in here. Okay, Dries just didn't upload them. Dries. But that's good news. Wait, which ones do we need? Sorry, GOF. 3 and 4, 34. So that's going to be this one. Nope. Where did this enter? Here. And this one. Okay. So 33. Adrian says, I really look forward to my golf day. The guys and I take the train to Queens and shoot the back 9. It takes about 2.5 hours. I'm not as young as I used to be, so the walking takes a lot out of me. Thea packs my favorite snack to keep my energy up until we can have lunch at the club. I usually have an Arnold Palmer, just one. You know? Half tea, half lemonade, and just a splash of vodka. But you can't tell Thea. She doesn't know. Thea says, don't know what? She just returned to the room, drink in hand. Adrian pretends to cough, and Thea hurries over to fuss over him. Eric says, are these people from Long Island? Maybe. It doesn't say. But they're in the New York City emergency room, so... Congratulations! Adrian has survived the night. You continue your rounds to check on your other patients. When you return, you are surprised to discover an empty room. When you check in with the nurses, you learn that Thea convinced one of the other doctors to release Adrian to go home. Whether you are ready or not, it's time to fill out your final report. Okay. Wow, okay. So we can't even do anything else. Alright. That's really funny. So we actually don't know for sure, like everything. Okay, so we have to fill in a final report where we have to say the causes. So what caused the patient's symptoms? Okay, so he said she makes my favorite snack. Let me see what she said about that, because she had a whole thing. His favorite snack after school every single day, a banana with a smear of peanut butter. That's his favorite snack. I wouldn't exactly know. What did she say about... Oh, you can't see me? Oh, sorry. Yes. He's on a diet. He's also on a diet. What did she say about, like, the foods? Right. She got a fancy peanut butter. I think it's the fancy peanut butter. I think that the food that she got... I don't know if there's a test we could have done, necessarily. Let me see this blood test. I know we can't do anything right now, because they left. That's so weird to just, like... This blood test, lab HBCO. I think that's to do with... Lab HBCO. Measures the carboxyhemoglobin levels in the blood to diagnose carbon monoxide poisoning. What is carbon monoxide? I mean, I know what... It's not a condition. Carbon monoxide. What would that be? Not brain health. Where would I find that? She says, love peanut butter. Yeah, you do. Yuck. That's weird. I feel like we should be able to see what that is. Carbon monoxide poison. But... Oh, that's interesting. So this booklet about brain health also says about confusion or lethargy. It says imaging or testing depends on the cause. Stroke or traumatic brain injury, immediate head CT scan. Dehydration or low blood sugar, do a lab chem 7, carbon monoxide poisoning. Lab HPQ. All right, so it could be that he has carbon monoxide poisoning. We don't know that, though. But I suspect something to do with the food that she buys for him. So I'm gonna write down salmonella, because salmonella is what caused it. Probably due to food Thea makes. And I'm blaming the special peanut butter because that was his favorite snack. Tree says, how is carbon monoxide linked to golfing though? Well, I thought carbon monoxide was in the air, yeah, so I'm confused about that, but I think that there must be something in it's not, Eric says club might have a leak. I don't think it's linked to golfing as much as it is that for golfing, she makes him his favorite snack, which is that peanut butter with banana, and either the vegetables or like something with that fancy peanut butter she bought, something with that. Peanut butter, banana is what causes it. I think she might only make that for him when he goes golfing. But we don't know that for sure because we weren't able to do a blood test. So we might get a penalty on that. But hey, they left. I was gonna do it, and they left. And then it says treatments. What treatments did you provide to treat the patient's symptoms? And we gave antibiotics and an IV. Carbon monoxide butter. Yeah, maybe. And that's all we did. I don't think there was anything else. And then it says recommendations. What recommendations do you have for the patient? E.g. drug prescriptions must be featured on status card, future tests, lifestyle changes, and other actions. Wash your hands before handling food. And quit with the dollar store. Quit with those bargains. That's my recommendation. And of course, plenty of fluids, etc. Okay, so now that we're finished, we can grab the epilogue, which looks like this. It's a whole ass story. I'm going to oops. I think I have this somewhere. I don't. Uh-oh. Teresa, we not take a picture of this? Oh, we didn't. I forgot to do this. Oh, I'm so sorry. Alright, well, that means I'm going to be reading a lot of text to y'all. This is what it look like. And it says, Adrian's confusion and lethargy are concerning. He might even have brain damage from his fall in the bathroom. A CT scan of his head shows that his brain has some atrophy, but indicates no immediate risk of stroke or brain damage, which we did. Adrian's diarrhea is alarming for a person of his age. He is likely dehydrated, which could lead to kidney failure. While an anti-diarrheal will provide Adrian some relief, it does not address his more critical need to rehydrate. Hydrating Adrian with IV fluids makes him more alert and prevents potential kidney failure. Next is Adrian's mysterious illness. By talking with his wife Thea, you can learn that his illness has happened before, always a day or two after he goes golfing with his friends. Given that the illness has caused his diarrhea, you have the option of taking an abdominal CT scan or a stool culture. An abdominal CT scan requires a contrast dye to take a good image, but Adrian is allergic to contrast dye. A stool culture is a more appropriate test, which is what we did. This reveals that Adrian has salmonella. If you delay discovering this, the combination of dehydration and salmonella could result in sepsis, where the infection triggers a chain reaction throughout his body. Antibiotics are the best course to treat salmonella. While ceftriaxone is typically preferred over ciprofloxacin because of its side effects, Adrian's allergy to penicillin eliminates the use of as it might cause him to have a severe anaphylactic reaction. If Adrian were to have such a reaction, epinephrine might need to be administered immediately to prevent death. With IV fluids and the right antibiotics, Adrian's situation can be stabilized so he survives the night. However, salmonella represents a potential threat to others. You need to identify the source to prevent Adrian or others from contracting it again. But Adrian and Thea eat the same food, so why doesn't she have salmonella? And why does Adrian keep getting sick? Sometimes the patient and their family hold the clues to their condition. Thea is worried about Adrian, and her thoughts are somewhat scattered. Her recent grocery receipt doesn't give us any clues because this problem has been going on for months. Of all the foods Thea mentioned, only the canned chicken, sardines, and peanut butter have a shelf life over several months. That Adrian's condition has reoccurred. As you talk with Adrian, you learn that when he plays golf, he has lunch and a drink from the club. However, if this were the cause, other people would also have been affected as well. But Adrian also brings a snack with him that gives him energy. Thea shared that Adrian's mom made him... he said his favorite, but okay. Thea shared that Adrian's mom made him bananas smeared with peanut butter as a child to give him energy. She also talked about having bought peanut butter a few months ago, even though she doesn't like nuts. It seems Thea overlooked that she makes Adrian a peanut butter and banana snack for when he goes golfing. It doesn't take much effort to find out what kind of peanut butter Thea bought and discover online that it was recalled for salmonella because 9 other people died. And in parentheses it says, based on a true story. Oh boy. Then it says, congratulations! Not only have you saved Adrian, you have prevented others from being infected as well. Turn page for score. I know, and I feel like one of these story cards will probably say that you find on the internet what kind of thing it is. Can we ask her that? I don't know. Anyway, so score. It says plus 50 points if Adrian survives the night, which he did, so that's 50 points. It says plus 10 points if you confirm that Adrian has no brain injuries with a CT head scan, which we did. Andrew says, banana peanut butter, yeah, that's also one of his favorites. Plus 10 points if you hydrated Adrian before 4 a.m. We did. Just right before. So that's another plus 10. It says plus 10 points if you gave Adrian antibiotics before 6 a.m., which we also did because we did that even earlier. It says plus 20 points if you uncovered peanut butter as the source of salmonella. If you didn't, Adrian is back in the hospital a few weeks later with the same mysterious illness. Here's the thing with this game. I did, because I did call out the peanut butter, but I didn't confirm it through anything. And I feel like I'm going to cheat by looking at these cards, but I'm not going to be playing it anyway. Oh boy. I think he can die. Eric says, I think you have to ask her the question about the food. I don't think there was a question about the food. Oh, what has he eaten in the past week? But it's not about this week. Oh, here's a card where he dies. So it's definitely possible. Emergency, another one where he dies. Some blood test. There's another one where he dies, another one where he dies. Oh yeah. Here's her receipt. So there is a way to get her receipt. Bargain food for less, where you save more for your money. Ham, half and half, flour bunch, canned bananas. I don't see the peanut butter. He be dying, I know. I'm just looking this up because I'm like, can I say... She bought the peanut butter months ago. Exactly. So I feel like... So there's no card that I think says the peanut butter is infected or whatever. So I feel like I can give myself the points because I did mention that I thought it was the peanut butter because of the things mentioned in the story. So I'm just gonna give myself the points. And it says minus 10 points if Adrian had a severe anaphylactic reaction to either the dye or the other antibiotics that I will not be mentioning again. And minus 5 points for each overtime action you took after 8 a.m. Okay, so I guess you can go after 8 a.m. as long as he's alive and didn't leave. But we didn't. Which gives us 100 points exactly. Yeah, I think that's the perfect score. So we got the perfect score. Woo! Good job, team. Couldn't have done it without you. And that is how the game works, basically. I like this game a lot. I love this little puzzle of trying to, like, you get the clues and like it's a little different from solving crimes, which I feel is usually the theme of these kind of games. So I really like this system, and I already almost ordered the Miami one. I was like, let me finish this one first. But yeah, what did you think? Did y'all like it? I'm just reorganizing these cards. Tree says was fun. Do y'all think this works on stream? Because I might do more in the future. Were you able to like follow along with the things? Eric says, yeah, it was fun, and the logic makes sense now. I can see how a doctor would just know the answer. Yeah. So, I don't want to spoil the tutorial too much. But I knew something about what was going on in the tutorial, so very quickly I was like, wait. Tree says, the cards were very easy to read. Or, well, he says were very to read. Wonder who did that. Yeah. Oh, very clear, yeah. Mom says it was fun. Works well on stream. Good. All right. And you know what? I might do this more often. I already made a thing of what I'm streaming next week. But I might stream patient number 3 then next time, which is also a medium. Not a medium as in occupation, but difficulty. I actually found this one, I was going to say I found this one a little easier than the easy one, but I messed up really bad on the easy one because there was such a detail. They survived the night, but there was like a tiny detail that was so cleverly done, but I feel like this one was easier than the other one. But that's also just like whatever detail you latch onto, right? So yeah, I'll definitely be doing that. As for streaming, I can do this after a stream. As for next week, this was a bit of a shorter stream. I had no idea how long this was gonna last. Eric says, I feel like this one was pretty easy, unless you missed the allergic reaction thing. Yeah, I agree. I do like that this game wants some intelligence from you. Like, it does hand you, like, all the information, with all the booklets that explains what everything does, and that can give you some hints as to, like, what you should be doing next. But that's a part of this. That's like the point of the game, right? But I like that it wants you to pay attention and it wants you to think and read and make those connections. Like with the peanut butter thing, that was not like, again, as far as I could see, there was no card that was like, yeah, it's the peanut butter. It's just like, you have to be like, wait. She mentioned this, and she mentioned the other thing before, etc. So I enjoyed that a lot. As for next week, so I didn't post it yet, but I'm gonna. I will be streaming on Wednesday. I have a very, very busy week coming up. So I'm streaming on Wednesday at 10 a.m. PST or 1 p.m. EST or 7 p.m. So basically same time as today. And I will be streaming the game Duck Detective: The Secret Salami, which it's a video game where you're a duck detective. So I'm going to be solving some more stuff, solving crimes. Then on Saturday, I will be streaming during my day, which is at 7 a.m. PST or 10 p.m. EST. Oh, not PM. That's AM. I gotta change that. 10 a.m. EST. And that's 4 p.m. UTC plus 1. So 4 p.m. Amsterdam time. And I will be playing a game called Copycat, which is a little indie game where you're a cat. And I think it's about like rejection or something. Like it people said it was sad. So I don't know how I'm going to be holding up with that one, because I think it's about this like street cat or whatever. So we'll see if I cry. But I have it. I was like, this is a perfect opportunity. Eric says, salami, duck. And Frostnight says, sounds quacky. I know. Animal games. I'm playing animal games next week. That's what I'm doing. So yeah, hope to see you there, and if not, they'll be on YouTube, and if not, I'll hopefully see y'all later. Thanks for, hanging out, checking in, and helping me solve this medical mystery. Again, that's Medical Mysteries New York Emergency Room. And there's also a Miami one. So yeah, thanks everyone, and I hope you have a wonderful day, evening, night, and definitely life. Bye.